button that you may be able to make a choice of English or Japanese as the main language for your participation. So please take advantage of simultaneous interpretation. Thank you. 以上が同時通訳の説明です。それから今日はですね、普段はウェビナーでやるんですけれども、できるだけ活発に皆さんと議論、質疑応答したいということで、オンラインの参加者の皆さんは、これ通常のWebEx のセットにしています。ですので、皆さんは、ウェビナーと違って、皆さんの、声が直接聞こえますので、後の質疑応答の際に、直接発言なさりたい方は、マイクオン、カメラオンにしていただいて、直接、どうぞご発言を活発にお願いしたいと思います。でもちろん、Q&Aのところですね、Q&A のところ、WebEx の下の右の方にあると思いますけれども、そこに質問を書いていただいても構いません。書いていただいた質問は私の方で皆さんの代わりに読み上げたいと思います。進行中、随時書き込んでいただければ、Q&A の時にそれをピックアップするようにいたしますので、よろしくお願いをいたします。では中身に入ってまいりたいと思いますけれども、この世界銀行の日本社会開発基金ジャパンソーシャルデベロップメントファンドというのは、2000年に日本政府のサポートのもとに設立された信託基金の一つです。で、世界銀行で諸々にある資金の仕組みの中でも非常に稀な特徴として、NGO、シビルソサイティの団体の皆さんに直接実施パートナーとしてですね、参画していただくことが可能な、そういうスキームです。で、年に1回程度、でこれ本当はもっと頻度を増やしてしょっちゅうやりたいんですけれども、年に1回程度、この今のところはですね、日本社会開発基金で実際に資金を提供しているプロジェクトの事例を紹介するということをやっております。で、今日はそのプロジェクトのうちの一つで、このベトナムでですね、まだ実施中なんでありますけれども、日本語のタイトルとしては、高齢者の収入健康脆弱性削減プロジェクト、Reducing Income and Health-Related Vulnerability of Older Persons in Vietnam というグラントプロジェクトがありまして、今日はこの全体で最大2時間の時間の中で、このプロジェクトについてご紹介をしてまいりたいと思っております。で、進行のフォーマットでありますけれども、まず、この世界銀行のベトナムを担当しているチームからですね、ベトナム、全般的なコンテクストのことを含めて、メッセージのビデオがありますので、それをご覧いただきます。で、その後、このプロジェクトを担当しているタスクチームリーダー、世界銀行では各プロジェクトごとにタスクチームリーダーというのが任命されていまして、これは世界銀行の職員なんですけれども、今日はタスクチームリーダーの一人が東京にいて、でもう一人の共同タスクチームリーダーがベトナムにいますが、その二人からこのプロジェクトの概略についての説明があります。で、その上で、このプロジェクトは NGO の皆さんに実施パートナーとして参画していただいている案件ですが、その実施パートナーであるヘルページインターナショナルのベトナムのチームの皆さんから、ベトナムから今日はオンラインでこのプロジェクトの実際に参画をした中での経験談、苦労、いろいろなこれまで蓄積されたことをご紹介いただくということにしております。で、それからさらに、実は今年の1月の下旬なんでありますけれども、日本の NGO2 団体の方に、これはシャプラニールの竹下さんと、それから村の未来の原さんでありますけれども、お二人に実は、私ども世界銀行のチームがこのハノイに行って、ベトナムに行って、この今日紹介するプロジェクトの実際の現地を見に行く活動を行ったんですが、そこに実はお二人にも来ていただきまして、実際にどういうふうに JSDF がこのプロジェクトにおいてですね、活用されているのかという状況をご覧いただきました。で、竹下さんと原さんにも今日はご参加いただくことになっていて、その後にですね、お二人から実際にこのプロジェクトをご覧になった コメントをお話をいただきたいと思います。で、私どもとしては、この、中長期的にぜひ、一つの団体でも多くの日本の NGO の皆さんに将来的には今日ご紹介するこの日本社会開発基金に参画をしていただいて、実際に実施団体としてご参画いただくようなそういう機会が今後増えてくるといいなというふうに思っておりまして、そのあたりの期待も含めて竹下さんや原さんに後ほどコメントをしていただきたいというふうに思ってございます。で、その後皆さんから質問をお受けしたいと思います。会場におられる方はマイクのボタンを押していただければそのまま発言していただけますし、オンラインで参加していただいている方はマイクオン、カメラオンにしていただければそのまま今日はご発言いただけるということで、事前にいくつか質問をいただいていますが、もしシーンとなってしまったらそれを読み上げますけれども、できるだけ皆さんからどんどんご発言いただくということで進めていきたいと思っておりますので、よろしくお願いをいたします。では最初にですね、これはビデオのメッセージでありますけれども、カントリーコンテクストの紹介ということで、世界銀行のベトナム事務所でヒューマンデベロップメント人間開発分野のプログラムリーダーをしているクリストフ・レミエールのメッセージを皆さんにご覧いただきたいと思います。よろしくお願いいたします。音が出てないですね。
I just wanted to take a few minutes of your time to explain why we have been working on this topic and what are the lessons we can draw from that. So as you know, in terms of demographics, Vietnam has a window of opportunity since 2007, and it will enjoy this till 2042. Now, when we look at the projections for population, they show that by 2049, the number of elderly people will increase to almost 20 million, which will be 18% of the population. And that makes Vietnam one of the fastest aging countries in the world. Now, if we look at the concrete situation of a given elderly person, at age 60, you have on average about 23 years of life expectancy. But out of these 23 years, there are only 17 years of healthy life. And of course, that generates a lot of needs in terms of personal care, and not just in health services. In Vietnam, just like in many Asian countries, most of the care for elderly people is provided by the family. But this is a model which is increasingly strained by urbanization, migration, labor market dynamics. And at the same time, we have a government involvement which is rather limited in this area, and the private sector also is not much developed. So we end up in a situation where the best option is to ensure we have a very strong community-based model. And this is exactly what has been done with this project that we did with HAI, and the project was called Reducing Income, Health and Social Vulnerability of Elderly People in Vietnam. It was financed by the Japanese government, and we believe that this model has been highly appreciated by policymakers, not only at national level, but also local level. And of course, it has been highly appreciated by beneficiaries themselves. We also believe that the results from this project in the project areas can be rather easily replicated in other areas of Vietnam. So we are extremely happy with this partnership with government of Japan. And when I say government of Japan, it is that we had collaboration with the embassy of Japan, but also with JICA. And this was not just for this project. On this topic of aging, JICA also supported the preparation of an aging report in 2019, and we benefited from insights from several professors from Japanese universities. And also, there was recently technical and financial support from JICA to organize a study tour in Thailand, again, to better understand the opportunities in terms of elderly care models. So we believe that this collaboration has been extremely fruitful, and we hope to continue and expand it, this collaboration, in the coming future. Again, thanks for your involvement on this, and happy to have this further discussion with you later on. Thank you.
Thank you very much. That was.
Thank you, everybody. Very sorry.
Thank you. We don't have to watch the video again. But that was Christophe Lemière, who is the program leader for human development in Vietnam on behalf of the World Bank's country management unit for Vietnam. Thank you very much. So next, I would like to invite the task team leaders, two of them, Emiko Masaki, who is the senior health economist in the World Bank's Laos office, and also Nga Thi Nguyen, who is a co-task team leader, who is the senior social protection specialist in the World Bank Hanoi office. Emiko-san is with us in Tokyo today, while Nga is joining us from Hanoi. So I'd like to pass the microphone to Emiko-san to give us the overview of the project. Thank you.
Thank you so much. So could I ask the presentations to be uploaded, please? Thank you. So I'll be presenting this from here, and then I'll also invite my colleagues, co-team task team leader, Gats, to come in to give us short remarks. But next slide, please. So this is just to build on what Christophe has started off in terms of the country context, but I just wanted to highlight some of the point that he has already made in his statements. So Vietnam is, I'm sure Vietnam is quite familiar for many of you, but just to get some of the key highlights in terms of the country context and why aging is so critical at this stage. So Vietnam is one of the most populous countries in Southeast Asia, and now is close to 98 million people, and of which 9 million people already over age of 65 and above, and which is equivalent to about 9%. And the other important points to highlight, the aging is often associated with declining fertility, and Vietnam is already seeing that sharp decline of total fertility rates, now down to 1.9, which is, it's not very different. I mean, it is different, but it is declining quite fast. Now thinking about Japan is 1.3, and South Korea is 0.9, which is the lowest in terms of the fertility rate. The next slide, please. No, the one before. Yeah, got it. Thank you. So again, just to highlighting how fast the rapidly aging is happening in Vietnam. So in this figure, again, to reiterating the points that Christophe has made, the share of populations age 65 and above is the Vietnam is actually following China, which is the fastest aging in this region, excluding that high income country, followed by Thailand. And Thailand is actually approaching very quickly to China, and Vietnam is immediately after. The figure on the right-hand side is also very important figures to highlight. This is the number of years took for countries to move from the the share of the older people from 7% to 14%. And this is very important figure. The country like France took more than 100 years to increase that the share of the older persons from 7% to 14%. The doubling took more than 100 years. And Japan has been always known as the fast aging country, but it took 25 years. And now Vietnam, the projection is now looking at 15 years. And it is very important. Many countries like similar to Vietnam, their aging is happening very rapidly, while countries are yet to become rich. So there's a number of issues that countries need to think ahead with the limited resources available to support that, the various the needs for the economy and social development of the country. The next slide, please. Thank you. So the World Bank engagement in aging agenda in Vietnam, we do analytics as well as this implementation of the project through JSDF. And this is the report that Christoph also mentioned in his remark, that the reports that done jointly with JICA started in 2019 and completed in 2020. I myself also involved in this report, worked on the health chapter. And this is really also highlighted some of the key recommendations in moving ahead for Vietnam to prepare for the aging society, and which pointed out the importance of looking at the community approach is certainly the viable options and cost-effective way to provide support and care for those needed. Self-help group are considered as a backbone for the care and provision in Vietnam, which was started initiated as a pilot. And this project has actually introduced in a way to institutionalize some of the key elements of this, the intergenerational self-help clubs, which I will discuss a bit more during my presentations. Next slide, please. Thank you. So now I go straight into the project information, just the overview of the project. So again, it has been introduced earlier. The project title is Reducing Income and Health-Related Vulnerability in Older Persons in Vietnam. And project is implemented in 6 provinces and covering 186 communities. And the beneficiary of this project is over 27,000 older persons who are age 60 or older and who are also in a vulnerable situations. Started in November 2020, just immediately after the COVID hit in many of the country in these regions. And the project has come to close in December this year. So, and with the budget of the 2.75 million, and funding sources is from the government of Japan through Japan Social Development Fund, JSDF, and our implementing partners who are also connecting and also presenting after this presentation is HelpAge International Vietnam. And we are also partnering with the Association for Elderly in 6 provinces where the project is implemented. Next slide, please. Thank you. So the objective of the project is to increase the participation of the older person in income-generating activities and their use of community-based health and social care services in 6 provinces in Vietnam. And these objectives are aimed to be achieved through these 3 elements of the interventions that's supported by the project. One is the livelihood support, which focuses on increasing the income of the older persons through the age-friendly, poor livelihood activities, which generate the appropriate income in old age. The second component is healthcare. And this part is really one of the key elements that's introducing the greater access of the older people to the basic services for health, and to keeping the older people healthier and active longer, and linking that the formal services with the community-based activities, which allow people to have a continuum of services where needed. And social care elements is supporting the community and home-based long-term care to enhance the quality of life of older people. who have a limited the activities in a daily living. So the next slide, please. So what is the Intergenerational Self-Help Club? We call it ISHC. It is a voluntary community-based organizations which often have about 50 to 70 members with a variety of ages, as we call intergenerational. But majority of the members are older persons and women and people and often the people with social and economic difficulties. But then in the spirit of working together, helping each other with the mutual support and to improve the quality of life. And it's a comprehensive model that cares for older persons and promote the role and participation of the older persons in various areas and assisting the adaptation to the aging society. So that's the premises of this ISHC models. Providing the models that adapt in a local context, local environment, encouraging participations and all. Thanks. The project has 4 components. So first component is the establishment and capacity building of this intergenerational self-help club. Next slide, please. So the component 1, the core activities are, in fact, to establish this community-led sustainable models and to promote the healthy, active aging and providing the income security of older persons and build capacity for the local partners and community in implementing these models and replicating it where feasible. So this component has key elements, and we often monitor the implementation of all our project activities with a specific indicator to allow us to see how projects are progressing. So there are a number of indicators that will be presented together as with the clear targets that we set at the beginning. So it's okay. So again, what is really the component 1 is a key element of the project, as many community doesn't have these models, how to bring these models to become more to established and to become the viable sort of community to allow people to come and to get access to services, but also contribute as a community member for their other people who might need for care and support. And the underlying assumptions for these models is the community are the best judges for how they live and livelihood can be improved. So often models coming with a different advice and the set of approach may work in certain community, but may not work in particular community. And I didn't mention in the beginning, but Vietnam is such a diverse country with a different ethnic groups. And each groups would have a different particular unique language and cultural beliefs and the norms, which often becomes important elements when you think about a healthy diet. What type of food you take, how you engage on daily living, and how you interact with family members and community. So establishing these models in a community that meets to the community needs is really the underlining critical assumptions for the success for the models. The next, please. And then second component is income security. And as country like Vietnam, the development of social security is not sufficient to meet with all their needs for the older persons. And in country like Vietnam, yes, there are still many older people living with family, but more increasingly, the younger people working in the bigger cities like Ho Chi Minh or Hanoi or any other cities and leaving the elderly alone in the community is not an unusual situations we see. So when you're left in a rural area And without sufficient the income security, it becomes even more vulnerable for older people to continue maintain their daily living. So this component aimed to strengthen the livelihood of the older person through access to the livelihood techniques and knowledge, and also the funding from the revolving fund, the managed and owned by the clubs itself. It is important for the older persons to have some sort of ways to access to financial resources, given that when you are no longer in a formal employment, the borrowing money is not an easy step. And but also the activities that more friendly to the elderly people, that could still allow for access to loan is very important for them. And then that alone, it's creating the older people, not just only the incomes that coming from this livelihood, but also their sense of living and also the contribution to the society. So there's a number of work, the activities, livelihood activities has been supported. And then sometimes that maybe the member may not have a good knowledge. I visited a few communities and which started with the raising of the, here we see it, the banana, but also like the vegetables and others, and or the livestock. But sometimes the people doesn't have sufficient knowledge or need some help. And then club itself, it's not just merely giving the money, but rather to helping with the knowledge and also experience from other members who have done the similar programs to help them to navigate through this process. And other important element is some of the older people, they are actually entitled for the some of the social security or government entitlements related to income security, but they are not just there to be able to receive them because they are not aware of such entitlement, or they don't have a sufficient documentation to allow them to access to those entitlements that often happen with the old age, the social security or disability insurance. And the club itself has also helped them to access to. And another also important part of that, the club activity is sometimes the small funds are maintained at the club levels that are often financed by the club incomes through this revolving fund or the membership and the local fundraising, which help then the club to maintain some of the funds that they can be provided to those who are needed in the community. And then they do actually assess sometimes some of the community member had some accidents would require some immediate, some cash to get the treatments, or need some devices to assist them for their walking and so forth. And then those small funds can be made available with the decision of the community, knowing that community have a best judgment in terms of who are the those who are in need. The next slide, please. And component 3 is a community-based health and social care. And this component is really to improve the access to the basic healthcare and promoting a healthy behavior and keeping elderly people active and healthy. That's one of the key objectives under this component. And also facilitate the members and also community to use community-based and home-based social care services so that they can benefit from the services available. The one thing that we see very important is that often community-based care is provided by other members or volunteers. But linking with the formal health services is particularly important. And this project, we have made particular importance in strengthening the linkage with the local, the community services with the formal care where they need it. The next slide, please. So this is just a snapshot of the health and community-based care that's provided. So often it's involved like physical exercise. So when you participate on the monthly activities, it starts off with the lots of physical activities and games, and people would actually engage. And in addition, there are monthly health screening and checkup, where we have health workers are actually from the local health facilities are coming to do the health checkup at the community. And we also have this home care services provided by the home care volunteers twice a week for those identified in need. Next slide, please. So the last component under this project is about the project management, monitoring, evaluations, and knowledge dissemination. So the project would support that, the overall monitoring and evaluation of the activities. We have started off as a baseline assessments and concluded the midline evaluations. We are expected to do the final evaluations toward the end of this year to see how these of the activities has translated to the output and then outcome, and then actually that resulted in impact on the ground. And we also, since this is the last year of the project implementations, we have gathered a lot of lessons. And we think it's very important to disseminate those lessons and also to continue to facilitate the replication of these models to other areas that are not supported by the project. So these are the components allow us to do such activities. Next slide, please. So this is one of the activities that the knowledge disseminations and advocacy work that Tui, who will be presenting after this presentation, have been doing the outreach. And I think she's also doing it now in a field. She's actually connecting from one of the fields to providing a training and also to understanding about the roles and responsibility of the older people and also the models, and to both at the local authorities and the communities, and how to bring the models to become more sustainable and in this context. The next slide. So this is a typical of the World Bank project. We have this theory of change and how all these activities are translated into the output and ultimately translated in an outcome. So these are the, we call the PDO indicators, Project Development Objective Indicators, which actually measured in 3 areas. I started off the livelihood support. So we are measuring the number of older persons have gained additional income through participating in the club livelihood activities. And second PDO, the indicator is on the healthcare, the number of older persons receiving the regular health checkups twice a week, and also the social care and number of the older persons receiving a community-based care services, which encompasses several, and all of which we expect that would contribute to reducing the income and health-related vulnerabilities among the older persons in Vietnam. So this is my last slide. Next slide, please. So often when we started off project like this, we got these questions. How can you sustain this after project end? And this was a question when we start preparing the project already. So since the early phase of the implementations, the exit strategy has been thought through and developed and applied throughout the project implementation process. And for us, it's very important to see, since the project ends, we need to have the owner, the local owner, who is going to take on this whole activities and continue to implement using the local resources. So having a local ownership at the provincial, at the community grassroots level is very critical. It's hence not solely depend on the project funds, project staff, project related activities. And results of the project implementation has been documented throughout and shared with the authority and related agencies, even during the implementations. The reason is really, as soon as the local authority sees that, the benefit, how that these models, the clubs has been benefiting my own community, they have a great interest to take part of it. So getting that results, documenting it, shared to the local authority and the various the events or interaction would help actually building their own ownership and buy-in, with the aim of integrating the models into the government programs or policies or local level. So again, in addition, the club models is not you can generate or organically. You need to have a certain structure. You need to understand the mechanism. You need to have a guidelines and manual, and also the hands-on support throughout. So there's a lot of training involved, and identifying the right the local leaders and capacitating them from the beginning, continue to build their leadership is becoming a very important part of the long-term sustainability. And also, one of the key bottleneck is the financial sustainability in addition to the technical. And again, the models has the revolving fund scheme. They also generate the incomes, and oftentimes a lot of donation come because they see the benefits, the local community sees the benefit. Then there are some ways to generate the local resources through these activities. And my colleague would also talk about this revolving fund has been very successful in a way that I think more than 90% of the repayment rate on time. And it's really about not borrowing money, but they have a lot of the value of their contribution to the society and having access to loan, producing, and then become an active member of the society. I think access to the loan has provided that. And in addition, that gives some flexible funds to the club to maintain and to continue to revolve and to fund. So I'm going to stop here. And I like to invite my colleagues who are actually based in Vietnam and working closely on this project to share more thoughts on this project from our end.
Thank you very much. So now, you want to come in to share your views at this moment?
Yes, thank you. Good morning, good afternoon. My name is Nga. I'm working at the World Bank based in Hanoi office, and I'm working as a co-TTL with together with Emiko for the project for the JSDF Japanese project. The presentation that ECO has been made, I think is quite comprehensive, and I just want to add a few broad things that or maybe highlight a little bit the impacts of the project that we haven't seen during the implementation of the project. So have you just seen the presentation, and you see that a lot of smile face, right? From the elderly people throughout the presentation that Emiko has made. Even like the life of people, elderly people is still very hard. But I think that we believe that with the support of the project, that the elderly people can also live their life in a more healthy and also joyful way. And during the project implementation, we also visited many family who are also the benefit of the project. And mostly, they are only elderly people. As also mentioned, Emiko has also mentioned that there are only elderly people living there. Very few young children stay with. Mostly, they are they are the middle or the people or working age people who already moved into other city to work. So we see that this kind of the situation it become even more obvious in the Vietnamese context, which is like more aging and more migration issue. So for this kind of model, we have seen that the community see this kind of model as a kind of a backbone of the care provision in the community. We have seen now like the project has been now implemented for 3 years. And then the project, but we see there's a lot of support from the government, from the civil society, from the elderly association, and also from the volunteers from the community who are expert in health and social care. So as you see in the presentation from Emiko, she's mentioned the project also provides, aged and also healthcare for the elderly in the community. And it is the first model that we see that there's active involvement of the two ministries, the Ministry of Health and Ministry of Labor, who are in charge, of this kind of area. So we see a lot of support and efforts, and also the participation and engagement of those ministries in kind of supporting and providing this kind of support to the community model that we implementing. And apart from that, we also see the elderly association. They are not only stakeholders; they are the key player in this community, because they are implementing this. They mobilize a lot of support from the community side. So we see that they are the most champion of the for the success of the project. And so it's like when we talk about the impact of the project, it's actually it's not only limited at the project itself, or what kind of the project bring in, but it's also like a lot of efforts that has been mobilized from different community, government agency, and the local government, local authority. In addition to that, we also see like because of with the support from the communities model that we have seen now, that we also see a kind of a motivation for women who in the past often a caregiver for the elderly people, who can now go out and work in the labor market, right? In the past, they are the female worker who are the one working supporting and providing this kind of care. But now with this kind of model, they can now go out and participate in the labor market, and that is also the impacts of the project we also see kind of indirectly. And the last point that I also mentioned, that's one also to mention that because of like the impact that project has generated, we also believe that the impact should not be only benefit for the project itself at the location itself, but also should be benefit to other location. And that is why in the last year, this is the last year, and during this year, we also want to pay a lot of attention on the quality of the activity of the project, as well as the sustainability. And there were, but we have also pay a lot of attention on the knowledge sharing, bringing policy maker into the project side, and also digitalize all of the project products, so that we can also share with other community in the same provinces, but also in other country, other provinces that have not yet benefited from the project. So I just want to highlight that the project is, or even like the impact of the project is go beyond that. The project has bring in, and but because of the mobilization of different stakeholder efforts has been made from different government agency, from the local expertise, even like we also mobilize the retired who have health and care knowledge, that they also participate in this project. So with that, I just start here, and I hope that we, from the World Bank side, we feel that we are really grateful to receive the support from the government of Japan, and we also look forward to receive further support from the government of Japan in the future, not only for these 6 provinces, but also go beyond that. Thank you very much.
Thank you very much. That was Ga Ting Nguyen, who is the Senior Social Protection Specialist based in Hanoi. And earlier we listened to Emiko Masaki, who is the Senior Health Economist based in Laos office. Both of them are task team leaders of this project. So let's go one step deeper. As I mentioned, the JSDF is one of the rare instruments of the World Bank that allow us to work together with the civil society organization as an implementing partner. And this project, the Help Age International, is the implementing partner. So before listening to the deeper stories, let's enjoy the video that we received from the Help Age International. So video, please. Thank you.
Intergenerational Self-Help Club, or ISHC, is a voluntary community-based social organization which works in a spirit of mutual support and helping each other to improve the quality of life. An ISHC has at least 8 core components, which are based on the top needs of the members of the community. First is the social and cultural component. It consists of having fun games and team-building activities, cultural performances, home visits, and exchange and sharing. The second component is income-generating activities, including a self-managed revolving fund, raising awareness on pro-poor and age-friendly livelihoods, livelihood support groups, and livelihood volunteers. The third component is healthy and active aging, which consists of physical exercises and sports, monthly health screenings, health and self-care awareness, conducting health checkups, improving access to health insurance, and a system of medical referral. The fourth component is community-based care, which provides various services for those in need, including social care, personal care, medical care, and living support. Component number 5 is self-help and community development. Every month, the club has activities to help each other and the community as a whole. It can be in cash or in-kind donations, labor contributions, or technical support. The sixth component is lifelong learning, which consists of monthly ISHC meetings, study tours and exchanges, and intergenerational cross-learning and sharing. The seventh component is rights and entitlements, which includes raising awareness of rights and entitlements, monitoring the implementation of programs and policies, providing legal support and services, and regular dialogue with local authorities. Lastly, the eighth component is resource mobilization, which consists of local donations, monthly membership fees, interests from the revolving fund scheme, and collective income-generating activities. Why the ISHC model is needed? To respond to this question, all we need to do is look at the impacts of the ISHC. The project was able to establish 180 ISHCs, which have a total of more than 9,800 members. The average increase in members' annual income was close to 60%. More than 400 sport and exercise groups were formed. The ISHCs have more than 1,800 home care volunteers, providing regular care services to more than 900 clients. The ISHCs have conducted more than 44,000 rounds of health checkups, and the health insurance coverage rate is close to 100%. The ISHCs have managed to fundraise more than $170,000 to support social and development works.
Ngày vào câu lạc bộ, tôi được tập thể dục thường xuyên này, được theo dõi huyết áp, cân nặng hàng tháng, cũng như biết được cách tự chăm sóc sức khỏe cho mình tốt hơn. Mỗi năm hoàn thành câu lạc bộ, kết nối với y tế, khám sức khỏe định kỳ 2 lần một năm. Ngoài ra, còn thường xuyên hát hò, giao lưu văn hóa văn nghệ và cũng có để giúp đỡ người khác. Như vậy, tôi thấy cuộc sống vui hơn rất nhiều. Sức khỏe của tôi cũng được cải thiện tốt hơn.
Trước đây là mình là người cô tuổi, cho nên là việc vay vốn là nó cũng gặp khó khăn. Nhưng mà từ khi mà có cái câu lạc bộ thành lập á, thì tôi tham gia vào câu lạc bộ và được vay vốn của câu lạc bộ để về mà phát triển kinh tế gia đình. Thì trước đây tôi cũng trồng hoa, trồng bông, nhưng mà cái vì nó thiếu vốn, cái nguồn vốn nó không đầy đủ, cho nên là nó cũng không gặp khó khăn trong việc sản xuất kinh doanh, sản xuất. Cho nên là từ khi mà được vay vốn rồi về tôi làm hoa như thế này đây. Và hiện nay vườn hoa của tôi là đủ màu sắc và rất là tươi tốt. Và hiện mình tham gia phát triển kinh tế gia đình thì một phần là được cái lợi ích là cho gia đình, bản thân gia đình mình là cái kinh tế nó phát triển, đồng thời á thì mình nộp lãi cũng đầy đủ, và từ đó các thành viên trong cái câu lạc bộ của mình cũng có điều kiện để mà từ cái nguồn và lãi đó để mà có được vay thêm.
Đâu cái tiền giờ cái đâu tiền tôi mà cũng nhiều hơn. Nhiều người cao tuổi như tôi vậy bây giờ anh chị em ở trong ban huấn luyện cũng thường xuyên nuôi tới rồi sao mà hỏi hàng tháng. Con người ta có đôi ba lần con cái đấy nó cũng có trái độ và kèm theo số tám
thuốc men chăm sóc đo huyết áp để
thì tôi thấy là bây giờ cái đấy là con cái nó mới lần trước đấy. Nhiều cái thì tôi thấy là tôi cảm ơn người ta là các cháu thật nhưng mà là coi như vậy. Trước đây thì làm nhiều cái chuyện đó thế mà nói về nó tóm lại từ ngày nó có cái câu lạc bộ sinh hoạt á thì nó đem lại cái thiết thực cho cái đầu ra sống vui vẻ cho cái tuổi cao người đã tuổi nhiều hơn.
I would like to take this opportunity to thank the government of Japan through the Japan Social Development Fund and the World Bank for supporting this very innovative and meaningful project. We hope that we can continue to build on this successful partnership. Thank you very much.
Great. Thank you. So now I'd like to formally invite the country director of the HelpAge International in Vietnam, Tran Bic Thuy. Thuy-san, please come in.
Thank you very much. I'm still very happy when I watch again the video, especially the voice from the 3 older person in the film. So can I have my slide, please? So it's coming?
It's coming.
Thank you. So you can see that the project has brought a number of benefit for the older people and their community as well. So can you go to the next slide? And in this presentation, I will share some of my reflections and also some of the lessons learned. The first one is about the reflection. So as the previous, as the Emiko and also Nga just share, we can see very clearly that through the intergenerational self-help clubs, in short it's ISHC, the project has brought a very comprehensive and also the long-lasting benefit for the older people. You can see that by the end of the year 3 last year, we conducted a participatory annual evaluation on over nearly 10,000 club members, correspondents, and we can see very clearly that the project has very good evidence to show that most of the club members reported that their knowledge is increased. They reported that they are wealthier with much increased income. Their health status is healthier, improved, and their confidence is also enhanced. Their overall well-being is also much improved. And also very important, they reported that since they joined the club, since they have the club in their community, the solidarity in the community is also very much improved. Next slide, please. The second reflection is that through the intergenerational self-help clubs, the project can reach the most hard-to-reach people, especially the homebound and bedbound. Most of them are people with disability, and many of them live alone, or if they live with their children also very busy with earning a living, or they migrate to other areas for job. So they just live alone. So you can see here, in my left side, the one older lady, she's 91 years old. 91 years old. She's living alone. She's very happy when the club sent 2 volunteers who are also older women, but they are just like 65 years old. And 2 of them come very often, almost daily, because they are neighbors. And the older person, she does not want them to leave her home. So You can look at her face, very big smile there. And she feels that the volunteers from the club have brought her the life again. So every day she's waiting for the volunteer to come to have a chat with her, and she's very happy. And on the other one, this old lady with disability on the wheelchair. The club also mobilized the wheelchair for her and sent 2 volunteers. So every day the volunteer come and take her out of her house for some time so that she can feel life is still there. And before the volunteer came, when we asked her what is her need, she said, I just want to die as soon as possible because I don't see that I am living. But since we sent the volunteers, the club sent the volunteers, she said, now I want to live longer because I feel that the life is much more joyful and meaningful. I have friends now, I have family members now who are not, actually it's not my family, but they become my family members. So you can see from the picture, it can tell a lot of things. And those people, through the ISSC, now can receive the support. Next slide. The intergenerational self-help clubs have already empowered the older people to be their architect of their own destiny. Actually, they become the agent of change and challenge the atheism. So in Vietnam, people still very common perception is that the older people is very frail, very weak, and we just help them. However, through the intergenerational self-help clubs, they can help, not only help themselves, but they can also help others. So they become can make the great contribution back to their family and their communities. So through all of this, they help to change the perception about older people, about the old age. You can see from the photos, they are very active with the income generating activities. They are mobilizing the resources to help others. They are dancing, they are singing, and they also do many things in the community. Next. Yeah, and we can see, as Ebiko and Nga mentioned earlier, we can feel and see very strong sense of ownership of the people and the community and our local partner association of the elderly towards the intergenerational self-help clubs. So the club provide initial support, but the one who mobilize more resources, who coordinate with others sectors like health and social welfare and the Red Cross and the Women's Union and others is the club themselves, both members and also the club management board members and the association of the elderly, not the help age or not the project, but they are the one who know that the club can bring a lot of benefit for their own people. So that's why they really see that the club is their own organization and they are responsible for mobilizing more resources, not only money, finance, but also technical support and in-kind support and many other things. And we can see here through the project, through the first 3 years of the project, our association of the elderly, our local partners, have already signed a number of the MOU with the health department or the women's union or even the youth union or the social welfare department to mobilize other sources to support the club and to support the older people and the other people in need. And we can see that the local government seeing the great benefit of the ISSC through our field visit and the other events. They already show their support, and many of them already use part of their government budget to contribute to the ISSC and to replicate the ISSC, the club, in their own areas. Next. Yeah. Another reflection is that the ISSC, the club, is really sustainable. And here I would like, first one is a fast, financially sustainable. The project invests about $4-5 US as the grant for the revolving fund, so that the club members who are in need can borrow the small loan from the club. And then every month they pay the interest, and the 50% of the interest is used to cover the club activities and expenditures, and the remaining 50% is used to top up the revolving fund. So the older the club, the revolving fund is bigger and bigger. And once the revolving fund is bigger, the interest amount returned back to the club activities is also bigger. So by doing so, so no matter during or after the project, the club still continue their own activities and their operation. That is, so the interest from the revolving fund is the first source of income. And the second source of income is a membership fee. So each of the member pay a small amount of fee, but altogether 50 and 70 members together every month, they have some money to cover part of their activities and running costs. The third source of income is the local fundraising. So the project, we train them how to do the local fundraising. It's very successful. In the take holiday or the day of older person in the community, they can raise a very good number of budget to support the people in difficulties. And the next source of income, that is for those who are very strong, they can also implement the collective income generating activities. For example, they have a group of older person who are very good at singing and dancing, and they serve this performance and service in the other communes, and they also get paid. Or they also borrow the land in the community, and they do the planting the banana or the rice together, and then they sell the products for income of the club. Apart from that, they also have some grant from the government or other donors as well. So with all these 4 or 5 sources of income, they can continue the project activities, at least 8 core components of activities and their running costs. That is the financially sustainable. The second one is the technically sustainable through the project. The project provide a number of capacity building to the training in the class, and also one-to-one technical support to each of the club, and also the cross-learning and sharing among them. And we also empower and build capacity of our local partners, Association of the Elderly, who are present not only just at the province level, but also at the district and also commune level to provide continuous technical support for the club during and after the project ends. And also, in addition, as I mentioned earlier, we also guided the Province Association of the Elderly to develop the joint collaboration program with other sectors, health sector or women's union or farmers union or social welfare, so that they can utilize the resources from the other sector to support the club in the long term. That is the reason why the club is really sustainable, not only financially, but also technically, also in terms of the policy or institutionally. Next slide. Yeah. Another reflection is that the model is really replicable. We can see that during the project life, up to date, we already established 186 ISSC in the 6 provinces. But you can see there are a very big number of the ISSC have been established by the local partners, Association of the Elderly in the 6 provinces. It's a 644 ISSC already established. So it's like more than 3 times higher than the number of the project ISSC. This is thanks to the project to establish and build a standard clubs to show as a showcase, as a learning hub for the community to generate the interest and for them to come and learn, and the club management board and local partner who are trained by the project become the trainer to the other non-project clubs. So we are very happy to see that now the ISSC is spread in other non-project communities as well. And every quarter, though it is not in the planned activities of the project, but we organize online knowledge sharing among the 6 provinces with the representative of the National Association of the Elderly to share the lesson learned and also to discuss how we can replicate this model in the non-project activities, and they learn from each other. And now, currently, we are working with the Association of the Elderly and also the 6 Province Association to advocate for the national replication of the project in the next 5 years. Next. Now, the second part is about the lesson learned. I think that there are a number of lessons learned. I think that first, we should do very proper consultation with the key stakeholder during the project preparation so that we can really develop a good model which can respond to the real needs, the practical needs of the older people and the communities. And without this effective consultation, maybe the model cannot as good as today, cannot be owned by the communities and the other stakeholders as today. And the second lesson learned is that the project development objective should really in line with the priorities of the local partners, communities, the target group, and the government, so that we can pool the other resources. Once it is fit with the needs and the wants of the community and the government, they will continue to maintain it, and also, more important, they will continue to replicate it. And the model itself should be very attractive and sustainable and affordable model. With the project money, we can easily build any model, right? However, to be sustainable and to be replicable, it should be very affordable and attractive to the target group, to the community, and to the government as well. And in this, the club management board is the key to success. So we should identify and select and recruit very right people to be the club management board, and identify right local partners. In this case, because our target group is the older person, so in this case, the local partner is Association of the Elderly, who are the representative of the older person in the country, who are mandated by the law to protect and take care of older person, and also to promote the role of older person. So when they join with us, they are part of the project, and more than that, they are own the project model. Yeah, they see it's their club. It's not the project club. It's not the project model. Yeah, and another lesson learned is that because this project is through the JSDF and also the World Bank and HelpAge as well, so we should right at the beginning, we should develop very clear guidance and the project operation manual. We also develop a number 9 manual to guide all the project on the club activities, because they have the 8 core area of activities. So it's not easy at the beginning. We should have the guidelines, we have the manuals, we should have the training materials, and work with them side by side until they are more confident and they can run by themselves. Yeah. Next. The other lesson learned is that we need to build the capacity of the club management board of the clubs, and also local partner association of the elderly, so that they can continue to not only maintain but develop, improve the clubs in the long run. And more important, how we should facilitate so that they can link and have the MOU, the collaboration program with other service provider, so that the club can receive the long-term support for sustainability. And the regular technical and monitoring support to local partners and also the club is also very important, because they are the community-based organizations. They have so many things. Each of the context is different, so they need different technical support. That is the reason why we build the capacity of the local partners at the commune level, so that they can more frequently provide timely and effective technical support to the clubs. Sharing best practice and lesson learned among the local partners, so that they can learn from each other and can share out to the non-project communes, is also very important, as I mentioned earlier. And engage the various stakeholders, including the donors, the policy makers, the lawmakers, and also the media, so that they can help it to spread the best practice, and also for them to really get their interest into the model, so that they can continue to support the model, especially in the replication stage. Is very important. And again, the habit team should master the World Bank and JSDF regulation, the safeguard and finance and procurement, all of this, so that we can have the good compliance. That is also very important. And we are very lucky that we have the World Bank tax team. They are all the way there to listen to us and all the way support very timely whenever we have any difficulties or anything that unclear. Next. Yeah, so that is all of the reflection and also the lesson learned that I would like to share with you more during the project implementation. We are now in the last year of the project. As Nga San mentioned earlier, we focus more on like documentation of the best practice, of the lesson learned, and we share this out to the non-project side. And we also develop the digitalize the project training materials ready for the wider replication during and after the project end. And on this, we are very grateful for the funding, for the financial support of the government of Japan. Very grateful to the JSDF and the World Bank for selecting, for supporting us this very meaningful and important model for Vietnam, which is very relevant for the social economic situation of Vietnam. And we do hope that in the coming years, we will continue this. We can still receive this support and the partnership with you, so that we can help Vietnam to more proactively respond to the very rapid aging in the very low setting context like Vietnam today. Thank you very much.
Thank you very much. ありがとうございました。ヘルプエイジインターナショナルベトナムカントリーディレクターのトラン・ビク・トゥイさんでした。これまでの JSDF ダイアログだと、ここでおしまいで、もうこれで Q&A なんですが、今日はもうワンステップディープに行きたいと思います。1月の末に、実際にこのプロジェクトを私どもが見学に行った際に、日本から2つの NGO の方に一緒に来ていただきました。で、今日はその2方にコメンテーターとしてご登壇いただくことになっています。で、お一人目ですけれども、シャプラニールのネパール事務所長の竹下裕二さん、今日はカトマンドゥから参加されていると思います。竹下さん、どうぞ。
はい、大森さん、ありがとうございます。皆様、はじめまして、私はシャプラニールの竹下と申します。今、大森さんからご紹介ありましたように、1月の末にですね、このプロジェクト、ベトナムの現場を見せていただいております。今日はその内容についてですね、簡単ではありますが、ご報告させていただきたいと思います。今、資料をこちらの画面に投影いたします。 今、資料映りましたでしょうか。
はい、大丈夫です。見えてます。
はい。では、ご説明いたします。ですね、全体の日程がですね、5日間、そして、実際の、会議と訪問、それは、3日間で行われております。このメンバーですね、今日ご登壇されている司会のサリム・トゥイさん、この後またお話しいただく村の未来の花さん、こういったメンバーでですね、言っております。でまずはじめに22日ですね、ハノイの世界銀行ハノイ事務所、ここで、世界銀行さんとヘルプエイジ、インターナショナルさんと会議をしております。そこで、この JSDF、このスキムの概要について説明を受けて、そして今、ここでご説明あったようなですね、今回のプロジェクト、ヘルプエイジインターナショナルさんの高齢者の収入、健康脆弱性の削減プロジェクト、それについての説明を受けました。そしてですね、その翌日の23日、24日にですね、この隊員コア州というところに、車で、大体ハノイから3時間、4時間ぐらいのところだったと思うんですけれども、行ってですね、このプロジェクトの、現場でどういう活動をされているのかというのを、見てきております。まずですね、初めの22日、この打ち合わせなんですけれどもね、これがこういうような、ハノイ事務所、こういうような内容で、この人気のような会議室で、この世界銀行の方々、そしてヘルプエイジインターナショナルの方々から、ご説明を受けています。それで、まずJSDF の概要なんですけど、それはもうこの約1時間随分皆さんお話しいただいていると思いますのでね、私の方でNGO の立場として、とても重要だなと思った点についてご説明します。まず一つ目は、その社会的にね、最も弱い立場に置かれている人、この人たちのニーズに直接対応するんであるよと。そして、その人たちのキャパシティを強化していく。そして、その人たちの開発プロセスへの参加を支援する。まさに参加型の開発、またサステナビリティを重んじる、こういうようなプログラムだと思います。そしてですね、これはNGO だけじゃなくてですね、各国の政府も応募できるということです。次にですね、じゃあ、どういうような手続きでこれをアプライしたらいいかということなんですけどもね。我々 NGO は今まで外務省のエンレンというスキームだとか、JICA の草の根というような、この助成金の仕組みを随分活用させていただいているんですけど、この2つはしっかりホームページなりでこうあるんですが、この JSDF は特に公示がなくてですね、通年で募集されていると。そしてワシントンのホームで年に2回の審査がある。で、じゃあ具体的にこの申請者はどういうふうにすればいいかというと、世界銀行の各国の事務所の職員、先ほど、正木さんからタスクマネージャーという言葉がありましたけれどもね、その方とコンタクトを取って調整して、この提案書を作る。そしてそれをワシントンの本部の方に、提出して審査を受けるというような手続きになります。この辺がですね、その日本の NGO ではあまり慣れていないところだと思うんですね。そこは一つポイントになると思うので、ここでお話しさせていただきたいと思います。そしてその翌日にですね、この隊員フォア省というところに行って、このプロジェクトの現場を訪問しております。先ほど、T さんから、詳しくご説明いただいたんですけれども、これは ISHC という、このこういう多世代間の自助クラブ、先ほどクラブが聞いたんですけども、クラブになります。その設立をして運営をしていくと。そして収入を得るための活動への高齢者の参加、そしてコミュニティに根ざしたこの保険と社会のケアサービス、さっき在宅介護とかのお話もありましたけど、そういう活動をしていると。それを実に、ベトナム全土でね、6省、180コミュニティ、2万7000もの人たちに対してですね、展開されているということなんですね。 で、まず我々、この単位ファッションについてですね、はじめに、このクラブのですね、集会に参加しました。このクラブですね、非常に活気があるもので、この今写真見えているのはですね、真ん中のホワイトボードにいろいろ書き込んでいるんですけど、前回の集会から今回の集会までの振り返りですね、どういうことがなされて、反省点どういうことかと。そしてそれを直にどういうようなつながりを持たせればいいかというのは、これも全参加で話しているんですね。で、もう本当にその発言する方がとても多くてですね、これ、我々 NGO っていうのは、いろんなところで、いろんな各地でプロジェクトやっていて、たまにこのドナーのミッションが来るということがあるんですけどね、これだけ活気があるようなのは、このミッションが来るから、その見せかけで活気を作るっていうような感じでは決してないと思うんですね。普段からこういう議論をしてないと、これだけ活気ある集会っていうのは作れないんじゃないかなと思いました。まさに全員参加型。またジェンダーですね。ジェンダーも非常にその女性の発言が多い。また女性が発言して、女性独特のその問題とか気づきとかっていうのをこのホワイトボードに書き込んでいって、次の活動につなげていってるっていうようなことが印象的でした。また、さっきビデオにもあったんですけどね、歌とか、ダンスをしたりして、一体感を出すっていうような話もさっきビデオにあったんですけど、そういうのもですね、みんなで、踊りを、この集会の始めと真ん中と最後でしてですね、ただこの議論だけで終わってつまんない集会にしないと、なんか全体でそういうような面白いリクレーションも絡ませながら、やるというような集会でした。ですね、いくつかね、この、現場の特に貧しい人たちの、家へのサポート、の様子を見せていただいたんですね。この左側の女性がさっきプレゼンテーションされていたヘルプエイジのツイさんで、その方がですね、我々いろんな家に連れて行っていただいて、その活動の様子というのを見せていただいたんですね。この今写ってる写真ではですね、一人おばあちゃんでも体が本当不自由でね、自分のこともできない寝たきりになってしまっているおばあちゃんたちを、こういう、真ん中に写っているような女性とか男性とかですね、いろんなこのクラブの人たちでボランティアでその介護のサポートをしていると。そういうような、クラブで全体でまさにその自助、共助、公助、そういうことをやれているというようなことだというふうに私は思いました。それでですね、次はですね、こちらなんですけど、その収入向上サポートということを活動の大きなものにしていて、さっきのビデオの中でも、今までそのローンをね、銀行とか、から借りられなかったんだけど、このクラブができてからローンを借りやすくなって、いろんな、ことができるようになったよと。それでやはりこのベトナムもですね、小作の人が多いようで、要は現金収入を持つっていうのは非常にこの貧困から脱していくために大切なことだと思うんですね。そこでこういうクラブでしっかりローンを貸して、ここで現金収入を持てる手段を、作っているというのはとても大切なことだというふうに思いました。それでですね、これが最後の写真なんですけれどもね、これは地元政府、高齢者支援委員会というのが、そことの情報交換をしている絵なんですね。この写真の右側がこの地元政府の方々で、左側が今回のミッションでいった今日登壇している人たちになるんですけど、ここで我々ね、どういうような、議論をされているかというのを見せていただいたんですけど、かなりもうその地元政府の方々がですね、この世界銀行、そしてヘルプエイジの皆さんの活動をすごくよく分かってというか、もう本当一緒になって活動しているなというのを感じておりました。これってとっても大切なことで、やはりその地元の政府の協力がないとですね、やはりそのプロジェクトの現行のプロジェクトを回していくのもなかなか難しいし、またサステナビリティですね、今後プロジェクトがここ何年か後には撤退してしまうので、この政府と地元のコミュニティ、クラブが一緒になってこの活動を持続するっていう場合に、この政府とどれだけ話し合って活動しているかっていうのは重要なことになると思うんですね。そういう意味でも、こういう情報交換を定期的にやれて政府の支援を受け入れているんだなと私は感じました。それで、最後、所感のところなんですけれどもね、まず1点目は、今までお話したような、草の根での密な対応、 非益者、自益者、支援者、コミュニティ、そして政府とコミュニケーションよく、事業を行っていますよと。それで、設定した目標に対して確実な成果を出していると。で、私、今回、訪問させていただいてお話伺って、2つ、留意点があると思うんですね。それは申請者側としての留意点。1つ目は、この事業期間内にね、明確な数字、人数と回数での結果を出す必要があるので、やはりこのヘルプエイジインターナショナルさんだけでなくてですね、この下請けとか窓請けの現地の NGO と密にワークが必要なんであろうなというふうに感じました。もう一つですね、この申請者の自団体に人件費 5% というルールがありますので、その 5% というルールで事業ができるリソース、財務的なリソースとか人材のリソースがある団体がこういう申請をして、事業を行えるんではないかなと思いました。以上、私の方からの報告になります。大森さんはじめ、世界銀行の方々、ついさん、本当にありがとうございました。とてもいい出張になりました。以上です。失礼いたします。
はい、ありがとうございました。シャプラニール、ネパール事務所の、所長の竹下さんでした。もう一方、ご登壇をお願いしたいと思います。村の未来の、業務統括マネージャーの原康子さんです。原さんは、今日は多分京都から参加されてるんじゃないかと思いますが、原さん、どうぞ。
はい、ありがとうございます。大森さん。そして、ベトナムのタスクチームの皆さん、トゥイさん、どうもベトナムではお世話になりました。ありがとうございました。今日、皆さんにもう一度画面上ですがお会いできて、とても嬉しいです。そして、またトゥイさんのプレゼンテーションを聞いて、トゥイさん日本に来てほしいなとまた思ってしまったところです。ありがとうございます。では、私、ちょっと自己紹介をさせていただきますと、NPO 村の未来というところで活動をしております。現在、村の未来は日本と、セネガルでの事業が同時並行で実施されておりますが、セネガルの方で私たち活動をしている件で、皆さん今日説明会に出たのが初めての方も2回目の方もいらっしゃるかと思いますが、私もたちの団体も昨年大森さんが開いてくださった説明会に参加して、これはちょっと出してみたいなと思いまして、大森さんにコンタクトを取り、セネガル事務所のコンタクトパーソンを聞いて、そこの今日ウェブサイトも見た方も多いかと思いますが、世銀が出しておられる日本語と詳細は英文でとありますから、英文の要件を満たす、これならいけるかなと思って、セネガル事務所に提案事業を持って行ったのですが、なかなかセネガル事務所で夏のバケーション時期に持っていったものですから、なんか休暇が続いて何のレスポンスもないまま、どうしたらいいんだろう、その通りやったのに、説明会で聞いた通りにやったのにどうしたものかと思っていた時に大森さんに声をかけていただいて、ベトナムの視察に同行させていただくことができました。そこでセネガルに世銀事務所に持ってってどうしてダメだったのかっていうのもこの3日間もう3日間というか、もう朝ごはんを食べてる時もぎゅうぎゅうにいろいろ質問をしていろいろ教えていただいて、その一部を今日皆さんにこんなことを教えていただいたんですっていうのを、申請のプロセディアっていうんですか、手続き的なことになるかと思いますけれども、ちょっとだけご紹介したいと思います。もうすでに竹下さんの方から言ってくださった点も含んでおりますので、重複箇所は避けてお伝えしたいと思います。ですね、最初の1日目、竹下さんがプログラムのシートを出してくださったんですけど、丸1日かけてベトナムでのプロジェクトの様子や、両方ですね、タスクティームリーダー側からはこんなことをしました、準備までにどんなことがあったんですかって聞きましたし、トゥイさん、インプリメンテーションをした現地の NGO にはどんなプロセスがあってスタートしたのですかって、アプライするところからスタートする時まで、そしてスタートしてからそれが 終わるまで、まだ終わってませんけどね、トゥイさんのプロジェクト、その2024年の1月までのどんなステップがあったのかを教えていただく時間を持ちました。ちょっとあまりにも内容が濃くてあんまり細分化できなかったんですけども、竹下さんと12のステップに細分化、こんなことをやってたんだっていうのが NGO 側だけでですよ、トゥイさんのお話だけでもし私が出すんだったらどんなプロセスがあるんだろうっていうので聞いていたので、竹下さんと始まるまでにはだいたい8個ぐらいのプロセスがあって、終わった後にはまた4つぐらい、これすごく大雑把な細分化なので、本当はそんな12じゃないわよ、もっと100個ぐらいプロセスはあるわよとトゥイさんとタスクチームリーダーの皆さんには言われてしまいそうなんですが、聞き取った中ではどうもスタートまでに8個ぐらいのプロセスがあって、それに何ヶ月かかったんですかとトゥイさんに聞いたら、12ヶ月ぐらいはかかってるんじゃないかなという、どこからスタートするかによって数え方があるんですけれども、12ヶ月から14ヶ月ぐらいは見といた方がいいかなと、スタートまでですね。そうするとスタートまでのこの14ヶ月何をしたのかっていうのをトゥイさんがすごく丁寧に教えてくださって、タスクマネージャーのお二人も教えてくださったんですけど、ものすごい仕事の量で、この間何人でやられたんですかってトゥイさんに伺ったら、2人で NGO 側の方はやっておられて、さっきレッスンズランドっていうところを見せていただいたので、皆さんそこと重複するかもしれませんですけど、あれがすごい仕事量で、準備までにも非常にきちんとやっていかなければいけないなっていうのを教えていただきました。でスタートすると、何人かが視察に来たりとかレポーティング出したりって、それちょっと大雑把にやったので4つのステップぐらいしかやってないんですけれども、エバリエーションがあったり、もうそれはトゥイさんのパワーポイントのプレゼンテーションでどんなエバリエーションがあったかとか書いて教えてくださったんですけれども、こうやって最後のエバリエーションまでいくのかと12ステップぐらいを挙げまして、そのうちどれだけ私たちの団体はこれができるだろうかっていうのも竹下さんと一緒に考えてですね、JSDF に向いている団体、向いていない団体って言って9項目ぐらい私たちで作ってみて、でもその向いてる団体というのはもう先ほどのプレゼンテーションで皆さんがちゃんとこの準備の12ヶ月とか14ヶ月にちゃんと人が配置できることとか、とても良かったんですね。ベトナムのタスクチームメンバーとトゥイさんの団体とのパートナーシップというのはすごく良かったので、そういう世銀側のタスクマネージャー、とても協力的なタスクマネージャーが見つかるかっていうようなクライテリアとかいろいろ作って、自分たちでじゃあここがないなとか、ここがないとダメだなとかいうのを竹下さんと一緒に考えてみました。そういうなかなか先ほど竹下さんのプレゼンテーションでも外務省とか JICA みたいにオープンになってないことも、そのプロセデュアですね、これだけの期間がかかってこれだけのこれだけの人とコーディネートをしなきゃいけないと、どの期間とやらなきゃいけないとか、準備にどれぐらい用意しとかなきゃいけないかっていうのが分かるものが、これから作っていただけるっていうのを、その前回のベトナムの最後のフィードバックをさせていただく時間のところでシェアリングがあったので、こういう説明会も含めてNGO の方がより出しやすいように、これならやってみようかなっていうようなステップがクリアになっていけばいいなと思いまして、私たちがわずかな時間でしたけど、すごいたくさん勉強させていただいたことを共有させていただきました。ありがとうございます。以上でプレゼンを終わりたいと思います。
はい、原さん、ありがとうございました。それから竹下さんも、コメントをシェアしてくださってありがとうございました。 予定をしておりましたスピーカーからの発言というのはここまでです。で、まずこの段階で参加をなさっている方、これは会場の方、それからオンラインで参加されている方からご質問、コメント、意見表明があれば伺いたいと思います。いかがでしょうか。はい、どうぞ。マイクがありますので、マイクスイッチをオンしてご発言ください。もしよろしければ、簡単に自己紹介をしてください。お願いします。
日本語で大丈夫ですかね。はい、ありがとうございます。素晴らしいプレゼンテーションと、それから現場からの非常にビューティフルなストーリー、非常に感銘いたしました。私、長崎大学の吉岡と申しまして、グローバルヘルスを専門にしております。で、今日ここに来た理由の一つがですね、今私が、スーパーバイズをしている、博士の学生さんですね。今年このテーマで、ヘルプエイジベトナムの方々と、一緒にプロジェクトをやりたいということで、今、プロポーザルを作っているところなんですね。なので、今日は私にとっても非常に、勉強になりました。ぜひ今後ともいろいろとお話ができればと思っています。で、一つ、お聞きしたいのが、このセルフクラブに参加されている高齢者の方々の、保険サービスへのアクセスが向上したという話があったんですが、それが果たして本当にこの高齢者の方々の健康の向上に結びついているのかどうかという点です。で、気になっているのが、これまで国際保険グローバルヘルスでは主に母子保険ですとか感染症というところに非常に重点を置いてやってきましたので、ベトナム現地のヘルスサービスプロバイダーの方が、その高齢者特有の健康のニーズにまだ対応できていないのではないかと思っています。で、このような、もしそれが本当であるとして、このような状況で、サービスへのアクセスだけ向上させても、それがなかなか、健康向上につながらないのではないかと、若干懐疑的な、見解を述べて申し訳ありませんけれども、そのあたり、現状についてお話を伺えれば幸いです。ありがとうございます。
はい、ありがとうございました。先に、皆さんから質問、コメントを出していただきたいと思います。他にいかがでしょうか。はい、どうぞ、このマイクを使ってください。
皆さん、こんにちは。私はタインと申します。ベトナムから来ました。はい、今、一橋大学国際公共政策大学研修士2年生です。どうぞよろしくお願いいたします。これから英語で話させていただきますが。So I was very expressive by your presentation and very, how can I say, informative. I feel like I extremely grateful for your yoga activity, like a very wonderful project conducted for the aging Vietnamese people, and especially for the low income community. So I have so many questions for you guys, but I feel like there is a limitation of the time, so I only set 2 questions. So the first one, from Thuy, I'm not sure about the name, so sorry, but like from Thuy Sang presentation, I feel like there is the criteria related to the impact, like the, how can I say, the impact of the program gonna be to raise the income and improve the health service, and also provide the health service for the aging people and community, the aging community in Vietnam. So do you guys have a specific frame of definition for the health package you provide to to the target community? And I remember Thuy Sang or Queen Sang, maybe. I'm so sorry, I forgot the name, but she Thuy Sang, yeah, also mentioned about the house has this very, very special cases that they can find out, like the very, very old lady who have no children, and they can accept the service and feel like have a lot from the help from the projects and the clubs. But according to my understanding, so especially in the urban area, there are many, many specific cases, like they also do not have children. They live by collecting rabbits and on their live and earn money, make money by collecting the rabbit, like spread in the streets. And I think the most challenging they have to face is loneliness, right? So for the thing that I'm heard today, like you guys tend to conduct the project among the rural areas. So how about the people who are living in urban, like especially for the aging people who are facing a lot of problems? Yeah, like you did mention. So, and what are the most challenges that you are facing during proceeding the project? So that is from my side. Thank you so much.
Thank you. Thank you very much. Now I'd like to invite the virtual participants to raise question, comment, points.オンラインで参加されている方でもしご発言なさりたい方、もうマイクをオンにしてそのままお話しください。いかがでしょうか。今40人以上の方が参加されているんですが。よろしいですか。大丈夫ですかね。それでは、追加的に、実は事前にいただいている質問がいくつかあるので、それを読みます。それでその後、発言順にタスクチーム、それからインプリメンティングパートナー、それからもし補足的な質問、コメントがあれば、竹下さん、原さん、それから今日はJSDF マネージャーのヨランダも来てますので、ヨランダからも補足的な発言をしてもらって、で、ラップアップというふうにしたいと思います。事前にいただいている質問ですけれども、まず一つ目です。日本では高齢者介護の現場において、ベトナムなどの ASEAN 諸国から技能実習生に依存することが増えていますが、ベトナムでも2030年代以降、高齢者の介護が必要になるケースが増えるとなると、ベトナムでの人材不足が懸念されます。日本では介護職が必要な職種でありながら、賃金面や待遇面での問題が取り沙汰されています。ベトナムではそうした人材をどのように確保していくのでしょうか、という質問です。それからですね、いくつかJSDF 自体についての質問をいただいていまして、これはラニーから後でコメントしてもらいたいと思いますが、一つ目は、アイデアブリーフのテンプレートがあれば教えていただきたいと思いますという非常に現実的な質問です。それが一つ。それからもう一つ、ご参加いただいている民間企業の方からの質問です。民間企業の立場で JSDF を活用することは可能でしょうか。可能であればどのような関わり方が想定されるでしょうかという、質問です。それから以前にいただいた質問をかなりすでにプレゼンテーションでリスポンスをしていただいているのですけれども、これを読みたいと思います。このプロジェクトで JSDF の承認を得ることができた成功の理由は一体何だったでしょうかという質問ですね。そういう質問があります。それでこれまで出た質問やポイントも含めて、順番に正木さん、それからガー、それからトゥイにコメントをしてもらいたいと思います。正木さん、どうぞ。
ありがとうございます。まず一番初めにいただいた質問、長崎大学の先生からのご質問で、保健サービスのアクセスのみでは、健康向上にはつながらないのではないか。で、まさしく、そのサービスって実際どんなサービスが提供されているんですか、質は担保されているんですかって。で、最近よく言われているのが、本当にアクセス で質が担保されてないサービスにアクセスするで、最終的にその健康向上もしくは健康害にもなってしまう。で、これは、ランセットとかいくつかレポートが出ていますし、やっぱりクオリティ、質をどういうふうに担保していくかというのは非常に大切な話で。で、今、高齢者の方々で、健康向上、もしくはどちらかというと健康維持、今ある健康状態をどういうふうに維持していくか。で、これに関しては、医療サービスというよりは、どちらかというと、このプロジェクトでもすごくサポートのメインになって、例えばスポーツに参加していただいたりとか、ヘルスアウェアネスプログラムであったりとか、どういう時にもちろん食べ物もそうですし、日々のどれだけ体を動かすかみたいなところで、やっぱり寝たきりになってしまうと、健康もしくは動くに関してすごく衰えてしまうのが早い。で、一旦寝たきりになった後でまた元気に戻ってくるっていうのはとても難しいので、寝たきりにならないように。で、早い時点でやっぱり予防していく、プロモーションしていくっていうのが多分プロジェクトで医療業務以上に大切なのかな。あとはやっぱり問題となるのが生活習慣病がやっぱりとても多いので、早い段階でのチェックアップで、そこから必要なケアであったらケアにつなげていくっていうのが一つ。なので、単にアクセスだけっていうのをおっしゃってたように、必ずしもそれが向上にはつながらないというのはあるところだと思います。で、一橋大学のタイさんですか、ご質問があった中で、私もたくさんクラブに行かせていただいて、100% の健康が欲しいかっていうと、どちらかというと誰かが来て話してくれる、ロンリネスっておっしゃってましたよね。やっぱり孤独でいる高齢者の方たくさんいて、で誰かが会いに来てくれる、週2回会いに来てくれる、で元気大丈夫ですかって手を握ってくれる、多分その効果自体も、じゃあ今日はちゃんと起きて何かをしようとか、いろんなモチベーションとかにつながるのではないかなと思ってます。これが医学的にじゃあどこまでっていうのはプロジェクトでは見ていませんが、病院の中で例えば常に介護にいる状況であるのに比べて必ずしもホームベースでやってることが劣るっていう、その状況にもよるんだと思うんですけど、医療業務とそれ以外のものでの、医療を維持する、健康を維持する、健康向上につながるというのは一つじゃないかなと思います。で、私があと一つレスポンスできるところして、あとガーに、あとトゥイに回したいと思うんですが、なぜアーバンエリアではやってないんですか。このプロジェクトルーラルですよね。で、プロジェクトの中でポバティとかかなり貧困っていうのが大きなフォーカスエリアだっていうのもあったっていうのは一つあるんですけれども、もちろんおっしゃる通り農村エリアとかの、高齢化問題と都市部での高齢化の直面する課題ってすごくやっぱ違うんですよね。で、私も今後世銀の中でも都市における高齢化の孤独もそうですし、サービスのアクセスについてもやっぱりちょっと農村部では違う。これをどういうふうに見ていったらいいのかなっていうのは今後世銀も取り組むべき一つの高齢化にっていう大きな枠組みの中でちゃんとこの都市部における高齢者の問題っていうのを課題として挙げていくべきかなっていうふうには私自身考えています。で、人材に関しては、ちょっとガーに振りたいかなと思います。で、私個人的にこのプロジェクトが成功した理由は、いろいろあると思うんですけど、やっぱり個々人、関わった人たちが、それぞれ皆さん大変な思いをしていて、時間もかかりますし、でもやろうと。コミットメントしてやろうっていう、そこにたどり着くっていうのが一つなんですね。やっぱり、実は私もプロジェクトを JSDF 以外にも持ってますし、で、これだけをやってるわけではない中で、やっぱりタスクチームとしてはどれだけ時間を割いてコミットメントしていくかって中で、やっぱりこのプロジェクトの意義をすごく こう感じるっていうこと、でここで何ができるんじゃないかって、やっぱ強い思いがあって、それと一緒にできるパートナーがいるっていう中で進めていこうっていうのはあります。で、私の中では一つ大きかったのはやっぱり忍耐。もう何度もやっぱりやり直さなければいけないプロセスがあって、12ヶ月、14ヶ月、そうだったと思います。何度も、PDO に関しても何度も書き換えました。で、インディケーターも何度も書き換えました。でその中でやっぱり、それぞれの思うところが合致する。先ほどトゥイさんもおっしゃってたように、やっぱり PDF とかそのプロジェクトディベロップメントオブジェクティブっていうのが、本当にそのローカルな人たち、国の人たちと合致するものでなければ、その後の存続であったりとか、サステイナビリティにはつながっていかない。でもちろんその JFDF から見た、これは入れなきゃいけないっていう、あとプロジェクト側から見た、これは入れていきたいっていう、多分いろんなところでこう、精査する必要があって、やっぱり時間はかかった。で、その分で皆さんが忍耐を持ってやっていったのが一つ、成功したのかなとは思います。So I'll hand it over to Nga for some of the response. Thank you.
Nga, please come
Do you
in.
want, yeah, okay, can I? Yeah, thank you, Emiko-san, for the response. I do agree with you. And to address the health status, the health need of the people, of the old person, here the project model is contributing to addressing the social determinants of health. Not just only this the health itself, but also the social determinants of health. So, so we see that we designed the club is very comprehensive, right? To promote their social participation, to promote their economic participation through the income generating activities. And they become the older person, but they also become the volunteers. We have the different types of volunteers, like home care volunteers, healthcare volunteers, economic development volunteers, so that they can be active and they can help others. So they can see the meaning of helping others. That all of this, and they also can access to lifelong learning opportunities when every month. They have the monthly club meeting and they allocate some time for learning something new from any resource person. And peer support, I mean the peer support, collective support in the communities also really encourage them to be more active and also more positive rather than like passive beneficiaries. The issues of like capacity of the health sectors, I do agree with you that now the health sector in Vietnam is not adjusted well enough to respond to the needs of the aging population. No, it's not yet. The government is trying, doing their best with the resources, but it's still very limited. And the capacity of the health sector is still the issues. And to address this in the project, during our training, we also invited the staff from the communal health center to join the training as well, so that they can, because you know that many medical or health workers are not aware of or not master of the health issues of the older people. They, through our surveys, they told us that they have never been trained on this. So that's why in the project, we also invited them to the project training together with the others, so that they can we can build their capacity. And more important, that we bring them together with the old people so that they can understand their needs, how to communicate with the old people, how to listen to old people, how to work with older people. It's not just the technical capacity, but also how to work with older people as well. Because if you do not know how to listen to them, you cannot know what are their health problems as well. Yeah. And then the health package, as Emiko-san already mentioned, the health package is very comprehensive. It's self-care. We provide knowledge and education section so that they can increase their own knowledge for self-care, physical exercise, dancing, and also the periodically health checkup and monthly health monitoring, monitoring their own BMI, high blood pressure, weight, scale, weight, all of this. And then they can, after the project training, they are able to monitor all those things. Yeah. About loneliness, yeah, that is a big issue, and especially not only in the rural, but also in the urban area as well. And actually in the project, we also have established the ISSC in the urban areas as well. One of the project site is Da Nang city, it's a center city in the center of Vietnam. So we have a number of clubs there. And in the other 5 remaining provinces, we also help set up the ISSC in the city of the center of the province as well. So the ISSC in urban or in the rural have their own advantage and difficulties. Depends on the context. In the urban areas, how to set up the club at the beginning was very, very challenging, because in the urban people are close. They are not like have the very good neighborhood like in rural areas, right? It's very difficult to come and to approach them. So it takes more time actually to gather, to have the members and have the packet people. However, once we overcome that, then it's easier, because the people in the urban areas are more capable. They have more resources to link with. There are a number of hospitals and many service providers there in the urban areas. I think the most challenging during the project implementation is the ageism. The people still think that, older people, they are needy people, and we just have to support them, give them something. But how to change that mindset? So the ISSC is showcase the older people themselves can be the contributor to help themselves and help others in the communities. And through that, we influence the policy maker so that they can not only see the older people as the passive, but also as a active agent of change as well. For the shortage of the carer, it's the same here in Vietnam. With the migration, not only within domestic, but also international migration. And young people now, they are very busy with earning their living. So even the older person live with their children, but during the day, no one there. So that is also a very challenging issue, and it is increasing nowadays in Vietnam. So that's why the ISSC now providing the volunteers. Each of them have 10 volunteers who are the neighbors of the older people. So actually, we put the targets at least 2 visits per week. However, many of them have the daily visit, not only 2 times per week. So that can help to reduce the loneliness of the people. That's from my end. Thank you.
Thank you very much. Actually, it's time now 4 p.m. 2 minutes past 4 p.m. already, which is sort of announced ending time of the seminar. But I would like to ask everyone to allow us to go for another 10 minutes. And then I'd like to invite Nga to come in to share your views. Then I would like to invite Yolanda Arzalcon, who is the JSDF manager, to come in. And then lastly, Maitre, I'd like to ask you to give us a final remarks. Nga, please come in.
Thank you. Thanks a lot for giving us opportunity to present the project. From the bank side, we see this kind of project as a kind of a collaboration with the bank, between the bank, the private sector, or the local NGO, as a best model that we have been engaging with over the past 3 years. we have seen like a lot of like activity happen around 3 years time. We visited many time to the family of the elderly people. So I see that like we had opportunity to see the the impacts coming and happening at this time when the project almost at the closing of the duration. So I think that on the presentation on the the effort and then the impact that has been already shared by different speaker from our side, I just don't have anything to to mention. Just thank again that for the World Bank office in Japan has organized this kind of event to have opportunity to present what has been done so far, and we look forward to see all of you in the future, and also look forward to see a lot of more support from the bank as well as also from the government of Japan in the future. Thanks a lot.
Thank you very much. Lani, please come in.
Thank you very much. So I just want to respond to a couple of points about processing JSDF applications, and to invite those of you who are around tomorrow. We will be having an information session on the Japan Social Development Fund, specifically directed to Japanese NGOs to help you understand the program better. But just a few words. The JSDF is a partnership between the government of Japan, the World Bank, who is administrator of the program, and the recipients. So it does take a lot of work, but that's the nature of this program. And so there was a question about the template for the idea brief. Let me clarify that JSDF projects need a champion or a sponsor inside the World Bank for various reasons. But so NGOs need to find a partner within the country team, in this case, Vietnam, or wherever you will be operating the project, so that your partner task team leaders, such as Emiko-san, who can prepare the idea brief and I guess shepherd it through the approval process of the JSDF. Private companies cannot be direct recipients of JSDF grants, but you can partner, you can be a service provider to a recipient of a JSDF grant. You can partner with the NGO or the government agency that receives support from the Japan Social Development Fund. So different ways of partnering with proponents for JSDF support. And how to successfully receive JSDF funding. So key elements are, it has to be a pilot that can be scaled up. There's a mechanism for sustaining whatever interventions you want to test with JSDF support, and that it's primarily directed to the poor and vulnerable. Thank you.
Thank you very much. So I would like to now ask Maitrey Das, who is the Director of the Trust Fund and Partnership Relations of the World Bank, to come in and help us to wrap up this conversation. Thank you.
Good afternoon, everyone, and good evening. And also, I think there are people who are joining from earlier in the day. So, hello, everybody. My name is Maitrey Das. I'm the director. I'm a director in development finance at the World Bank, in charge of trust funds, financial intermediary funds, and co-financing and partnerships. And, it's been a real pleasure. These last 2 days have been a real pleasure for us, and me and my team, Reese Cannell and Yolanda, to be here and to have discussions with our counterparts in the Ministry of Finance. But in addition to that, since the discussions were about JSDF and another trust fund that we have, the conversations were a lot about the ways in which JSDF affects life on the ground and has impact on the ground. And there are very few programs that we have at the World Bank that provide this kind of sort of small amounts of funding, but funding that allows for innovation, for piloting, and that have a focus on social development. There are very few that have a focus specifically on the poorest, on the most vulnerable, on the excluded. So it's been a pleasure to have these discussions about JSDF. And then today to listen to you all about the Vietnam project, because the issue of aging, as you know, is not just an important one in East Asia, but other regions are also catching up. So aging, you know, the population above age 65 is going to be about 1/4 of the global population in the next, in the next few years, actually. So even countries that we thought to be very youthful will be having both a large youth cohort as well as a large aging cohort. And that's a big challenge for those countries. So projects such as your project in Vietnam actually show the way, actually are important not just for Vietnam, but also for other countries that will learn from Vietnam's experience and from the experience of this particular project. It is also very heartening that the project is cross-sector, so it has the health team as well as the social protection team. So it is very much of a cross-sector project, which is unusual but very important. So really enjoyed hearing from our CSO partners, because when you undertake projects such as these, it is not just the World Bank. We see ourselves as facilitator. We don't see ourselves as the drivers. The drivers of this project are the communities themselves. And the drivers of these projects are communities and the facilitators who are CSOs. So NGOs, CSOs that are really leaders in this field and from whom we can learn a lot. So with that, I would like to close this session and thank you, Koichi, for always organizing these wonderful sessions that have people from all over the world joining, but particularly from among Japanese NGOs. Because I think that we need to do an even better job of reaching out and forging our partnerships with CSOs, not just in Japan, not just in Vietnam, but across the world. So thank you.
はい、ありがとうございました。4時11分になってしまいました。大変遅くまで、お残りいただきましてありがとうございました。先ほどから紹介がありましたが、明日27日の午後4時、日本時間の午後4時から、ハイブリッドでこの NGO の皆様向けの JSDF の説明会をする予定です。これはジャニックその他いろいろなルートでNGO の皆様にお知らせをしているところですが、今日参加の NGO の皆様で、もし詳細を知りたいということであれば、昨日から今日にかけて私の方からお送りをした WebEx のリンクをお送りしたメールに返信をして詳細を教えてくださいというふうにおっしゃっていただければ、ご連絡をいたします。ということで、長時間にわたってありがとうございました。これで、ベトナムにおける高齢者の収入、健康、脆弱性削減プロジェクト、日本社会開発基金によるプロジェクト事例というセミナーを終了としたいと思います。どうもありがとうございました。
Thank you.
Thank you very much.
Thank you very much.
Bye bye.
Thank you.
Bye.
Bye.